You're postpartum and you're feeling bloated, gassy, and has discomfort in your abdomen. What can you do about this? Now, I have a questions from you here asking and telling me my son is 20 months old now. I had a C-section this time, natural birth with my daughter that is 6 years old. My hips are tight. Lower back is weak, lower belly pooch, but not a lot of stretch marks and not much of a separation, so I'm thankful. It's good that you know you don't have ab separations. Just feeling bloated, gassy, and pressure, type of discomfort. So I'm not sure if I may be gluten sensitive now. I started back at Orange Theory this month and have gone out to jog for 20 minutes, but I can't seem to get consistent. Does it sound like you? Does it resonate with you? Now, I wanted to say that postpartum bloating is quite common. It's due to the stress in our digestive tract. The stress come from medications, if you're taking any medications, hormonal changes in your body, maybe you change from breastfeeding to not breastfeeding now, stress, right? Stress from taking care of your baby, daily physical stress, mental health stress, right? And then activity level, maybe you change from a lot of activities to no activities, or maybe you're just bending up and down all day. So all of those has an impact on your digestive tract, which can cause constipations, indigestion, so it's harder for your small intestine to digest the food, absorbing the nutrients. It's harder for it to pass down the digestive tract, causing more bubbles in your stomach, causing more abdominal discomfort, making you look like you're more pregnant. You have lower abdominal pooch, which is what this mom is talking about. It can also cause constipation. If you're not having daily bowel movement and it's a smooth poop, then you're likely is constipated. Because when you're constipated, you build up backup bloating, and the backup bloating is sitting in your colon, so making your lower abdomen pooch more than you want it to. And the constipation can irritate your pelvic floor muscles that can cause spasm, and it could spread to your vaginal area as well as your bladder. So if you're feeling discomfort, maybe a little bit of cramps here and there, that is likely that it's causing from the chronic constipations. And for this mama here, she's especially tell me that she has a tight hip, and that is making me think that she has a hypertonic pelvic floor. So her pelvic floor is overactive. So if you think about me with this palm here, you have a normal pelvic floor tone, meaning you're able to fully relax and fully engage the pelvic floor muscle. So if you're sitting here listening to me talking, are you able to fully relax your pelvic floor? And if you are wanting to like, okay, let's, stop from you passing the gas, can you fully engage it? And for this mom here, if she has a tight pelvic floor, her tone of the pelvic floor is constantly here. So it's harder for her to pass the gas. The gas is constantly trapping in here because she's not able to fully relax and let go of the gas. But it's also because she's always here, if she does engage her core, it's only going to make it tighter and tighter, and it could lead to even more tighter pelvic floor. So this is something that she probably wants to address. And because if she does have the tight pelvic floor, all of these could contributing that to the lower abdominal appearance that I know probably most of you guys don't want to have. You want to look good. I know you don't want to look pregnant, because I was like that too. Now, if you look at this photo, and I was about 3.5 months postpartum here, sometimes you might be confused. Okay, is it because that I have a lot of weights to lose? This is my belly, my abdominal fat. Is this what it is, or is it bloating? A simple test that you can do is a pinching test. A pinch on your abdomen. So if you're grabbing the fat of your belly, right? If you just grab it with your belly, how much are you able to grab it? If you're able to grab the muscles and the skins and the fat there, it's a mixture of your abdominal fat and skins and loose tissues, all of that. But if you are really not able to grab too much, maybe just a bit of that skin, but if you're poking into your stomach and it feels hard, then it's likely it is bloating more than the abdominal fat. Of course, if you're feeling both, right, you have abdominal fat, and then also if you're poking in your tummy and you're feeling that it's like kind of hard there, then it's a bit of both. If you look at that picture, I was so bloated. I was also overweight as well. Now, what can you do to relieve the symptom of bloating, gassiness, and discomfort in your abdomen? It's through two things: nutrition and lifestyle choices. First of all, with nutrition, you wanted to drink at least 2.5 liters of water per day. Hydration is the key. And if you're a breastfeeding mama, you definitely wanted to drink more, maybe about 3 liters or more of water per day. So you're maintaining your milk supply and also have enough hydration for your body. A lot of the time, moms will wake up first thing in the morning and they will drink a cup of coffee. And this is something that you really wanted to just hold back a little bit and wait until you have breakfast, because first thing in the morning, you're dehydrated from sleeping 6 to 8 hours overnight. You're dehydrated. The more coffee you drink right off the bat in the morning, the more it's going to dehydrate you, because coffee dehydrates you. So you wanted to start yourself, starting that engine and your system with 1 to 2 glasses of water every morning, first thing in the morning. Don't do anything else but drink your water. You can add some lemons in it. You can add some apple cider vinegars in it to help you run the system, so that you can actually push through that unwanted stuff that is sitting in your body out of your body, right? So drinking your water before your coffee, and of course you can drink a coffee, right? We all need it. And so drink it a little bit later in the day with your breakfast. Now, when it comes to food, you wanted to start with wholesome food. Wholesome food, cut out the ultra-processed food, cut out processed food as much as you can, limit your sugar intake, limit alcohol. Some food will cause bloating, and this mom is thinking about gluten, which could be, and some of us are more sensitive to gluten now compared to before baby. So you could try to reduce or eliminate them for 1 to 2 weeks and see how you feel, and if you're feeling less bloated. Also, having enough fiber is just as important, to have at least 25 grams of fibers in our daily life. Now, one of the supplements you can include into having more bowel movement, if you're not having a daily bowel movement, is magnesium. Women tend to lack magnesium in their daily life and not getting enough absorption and consumptions through their diet. So you could try having that magnesium supplement included in your day-to-day routine. Now, another thing you wanted to focus on to help you with your discomfort in your abdomen would be your lifestyle choices. I would recommend you to do a self-massage. You know how you do like an I love you massage for your newborn baby, because they have a harder time to go bowel movement, and you would do bicycle on their legs to help them to move. You can also use a massage ball or tennis ball to massage that pelvic floor area. You pretty much will just sit on the massage ball, and you will move yourself on the massage ball so that you're releasing some knots that is tight in your pelvic floor. More daily movement, more walking up down the stairs, whatever it is that keeps you consistent. And you were saying that you weren't able to be consistent. I would start with something that is realistic for you, whether it is to aim for 7,000 to 8,000 steps a day. You know, nowadays we all have a smartwatch on us, so look for the step. Oh, it's 3 p.m. now, right? How many steps have you taken, and until how many hours you go to bed, and is it realistic for you to walk another 3,000-4,000 steps? So take a look at that, pay attention on these little lifestyles habits, and it will come a long way for you. So that's all for today. I hope this video is helpful for you. If you want to learn more about what I do, you can go to my Tummy Warrior page, www.tummywarrior.com. I help clients one-on-one and create their exercises and nutrition program for postpartum moms and moms with diastasis recti. Thank you so much for tuning in, and talk to you next time.